الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Hepatitis B by Professor Mahmoud Hani Sulaiman. Summary: Hepatitis B is potentially a life-threatening liver infection due to hepatitis B virus. It is a major global health problem. It can lead to chronic liver disease and high risk of death from liver cirrhosis and liver cancer. More than 240 million people have chronic liver infections. 600,000 die per year due to acute or chronic consequences of hepatitis B. A vaccine against hepatitis B vaccine in 1982, it is 95% effective in preventing infection and its chronic consequences. It was first vaccine against a major human cancer. Hepatitis B, first it was epidemic jaundice described by Hippocrates in 5th century. Jaundice reported among recipients of human serum and yellow fever vaccines in 1930s and 1940s. Australia antigen described in 1965. Serologic test developed in 1970s. Hepatitis B virus. Hepatidemiologgy family. Numerous antigenic components. Humans are only known host. May retain infectivity for at least 1 month at room temperature. Causes of hepatitis as a whole. Hepatitis viruses, most cases of hepatitis worldwide. This is the first cause. Then toxin, alcohol, medications, some industrial organic solvents, and plants, and autoimmune disease. Causes of non-infective hepatitis, as you see: alcohol, autoimmune, drug-induced excessive intake of alcohol, autoimmune idiopathic, drug-induced acetaminophen, INH, tetracyclines, anti-epileptics, phenytoin. Transmission of infective hepatitis, hepatitis A and hepatitis E, fecal-oral, hepatitis B and C, blood and sexual. Causes of hepatitis. Hepatitis C virus 26, hepatitis C virus and alcohol 14, alcohol alone 24%, unknown 17%, other 5%, hepatitis B virus and alcohol 3%, hepatitis B alone 11%. Epidemiology of hepatitis B: reservoir human, transmission blood-borne, subclinical cases transmit disease, communicability 1 to 2 months before and after onset of symptom, 1 to 2 months before and after onset of symptoms, and there is chronic carriers. Epidemiology 2: more than 300 million chronically infected worldwide, established cause of chronic hepatitis and cirrhosis, human carcinogen leading to cause 80% of hepatocellular carcinoma, 80%. Epidemiology 3: hepatitis B prevalence is highest in sub-Saharan Africa and East Asia. In those regions infected with hepatitis B virus in childhood, and 5 to 10% of adult population is chronically infected. This is the distribution of hepatitis B virus infection worldwide. There is countries more than 8% high, those in dark. There is intermediate prevalence 2 to 7 like Egypt. There is low, less than 200% in this color, gray. Estimated international hepatitis B surface antigen prevalence. This is the region and this is the estimated hepatitis B surface antigen prevalence. As you see, North America very little, Mexico and Central America less higher, little higher, South America increase, Western Europe, Australia and New Zealand, Caribbean 1%, Eastern Europe and North Asia about 3%, South Asia about 3%, Middle East more than 3%, Haiti more than 5%, East Asia more than 7%, Southeast Asia more than 9%, Africa more than 9%, Pacific Islands more than 12%. This is the world map for hepatitis B endemicity. In red color high, this part of Africa, Saudi Arabia, Southeast Asia, North America, and here. Epidemiology for global pattern of chronic hepatitis B virus. More than 8%, 45% of global population. Lifetime risk of infection in these areas more than 60%. Early childhood infections common. Intermediate 2 to 7, 43% of global population. Lifetime risk of infection about 20 to 60%. Infections occur in all age groups. Low, less than 2%, 12% of global population. Lifetime risk of infection is less than 20%. Most infections occur in adult risk groups. High rates of chronic infections also found in Amazon, southern parts of Eastern and Central Europe, in Middle East and Indian subcontinent. An estimated 5% of general population is chronically infected. Less than 1% of population in Western Europe and North America is chronically infected. 90% of healthy adults who are infected with hepatitis B virus will recover and completely rid of virus in 6 months. 90% will recover in 6 months. Which child is at risk for chronic disease? This is an important question. Age of infection decrease leads to likelihood that infection with hepatitis B virus will become chronic. Children less than 6 years who are infected with hepatitis B virus are most likely to develop chronic infections. 90% of infants infected during first year of life develop chronic infections. 50% of children infected before 6 years develop chronic infections. So infection at lesser age lead to increased risk of chronic infection. Which adult is at risk of chronic disease? Less than 50%, 5% of healthy adults who are infected will develop chronic infection. About a quarter of adults who become chronically infected during childhood die from hepatitis B related liver cancer or cirrhosis. This sketch shows the composition of hepatitis B virus. At the outer is hepatitis B surface antigen. This is the hepatitis B core antigen. And this is hepatitis B E antigen. The significance of each will be known in coming slides. Clinical features of hepatitis B. Incubation period 2 months to 5 months. 2 to 5 months. Average 3 months. Non-specific prodrome of malaise, fever, headache, and myalgia. Illness not specific for hepatitis B. At least 50% of infection are asymptomatic. Complications of hepatitis B: fulminant hepatitis, cirrhosis, hepatocellular carcinoma, death due to hepatocellular failure, hospitalization. Chronic viremia with hepatitis B responsible for most mortality, overall risk 10%, higher risk with early infection. Hepatitis B perinatal transmission. If mother positive for hepatitis B surface antigen and hepatitis B antigen, 90% of infants will be infected, 90% of infected infants become chronically infected. If mother positive for hepatitis B surface antigen only, 20% of infants infected, 90% of infected infants become chronically infected. Risk factors for hepatitis B. Multiple 6 partners 24, other 23, household 3, 6 contact 13, MSM 17, intravenous drug users 20%. Case definitions for hepatitis B. Screening definition for hepatitis B infection is presence of hepatitis B surface antigen in serum. Hepatitis B surface antigen. This is very important. For acute hepatitis B, IgM core antibody equal recent infection. Clinical features consistent with acute viral hepatitis are jaundice, increased ALT and AST. Nota bene, presence of hepatitis B surface antibody equal immunity. So, hepatitis B surface antigen equal disease, anti-hepatitis B surface equal immunity. Interpretation of tests for acute hepatitis B. There is different presence and absence of different antigen, anti-hepatitis B, hepatitis B surface antigen, anti-hepatitis B core IgG, anti-hepatitis B core IgM. And the interpretation 1, 2, 3, 4, 5, 6. Acute hepatitis B virus and infection, early acute hepatitis B virus infection, resolved acute hepatitis B virus infection, not infected prior vaccination for hepatitis B virus, not infected chronic hepatitis B virus infection. If hepatitis B surface antigen is positive and anti-hepatitis B core IgM positive, the case is acute hepatitis B virus infection. If hepatitis B surface antigen positive only, it is early acute hepatitis B virus infection. If anti-hepatitis B surface antigen positive and anti-hepatitis B core antigen IgG positive, resolved acute hepatitis B virus infection. If hepatitis B surface antigen positive only, if and only anti-hepatitis B surface antigen is the positive one, not infected prior vaccination for hepatitis B, either not infected or prior vaccination. If the four are negative, not infected. If hepatitis B surface antigen positive and anti-hepatitis B core IgG positive, it is chronic hepatitis B virus infection. Control of a case. Exclusion from school and work until diagnosis is confirmed. Blood and body fluids precautions should be observed until disappearance of hepatitis B surface antigen and appearance of anti-hepatitis B surface. Control of contacts. Household contacts tested for anti-hepatitis B core and hepatitis B surface antigen offered vaccination if susceptible. Sexual contacts should have human hepatitis B immunoglobulin 400 international unit intramuscularly within 14 days of sexual contact. Begin vaccination at same time. Infants born to hepatitis B surface antigen positive mothers, both are very important. Hepatitis B immunoglobulin with lesser dose 100 international unit intramuscularly in 12 hours only of birth. Begin vaccine at the same time as hepatitis B immunoglobulin, but at a separate site. Here we have what to do with sexual contacts. This is the control of contacts. And what to do with infants born to hepatitis B surface antigen mothers. Strategy to eliminate hepatitis B virus transmission. Prevent perinatal hepatitis B virus transmission with vaccination and hepatitis B immunoglobulin, routine vaccination of all infants, vaccination of children in high-risk groups, vaccination of adolescents, vaccination of adults in high-risk groups. Prevention. Hepatitis B vaccine is core of hepatitis B prevention. Give all infants hepatitis B vaccine in 24 hours after birth. Those two or three doses to complete primary series. How? Either 3 dose schedule of hepatitis B vaccine with first dose at birth, second and third dose with with first and third of DTP vaccine, or the schedule of 4 doses where birth dose, then 3 vaccine doses given with the DTP vaccine. This is the one done in Egypt. Prevention. Pre-exposure vaccine for risky people. First risky group is healthcare workers, hemodialysis patients, recipients of blood products such as factor 8 and factor 10, 9, residents and staff institutions for intellectually disabled, those with multiple sexual contacts, injecting drug users, household sexual contacts of hepatitis B virus carriers, and inmates of long-term facilities. For chronic carriers and chronic hepatitis B virus, the definition of chronic carriers: negative anti-hepatitis B core IgM, positive anti-hepatitis B core IgG, or positive anti-hepatitis B core total. No clinical illness consistent with acute viral hepatitis. If hepatitis B E antigen present, it equals high infectivity of blood and body fluids, so blood and body fluids precautions. Hepatitis B vaccine composition: recombinant hepatitis B surface antigen, efficacy 95%, duration of immunity more than 15 years, schedule 3 doses. Booster doses not routinely recommended. Formulation of hepatitis B vaccine: 2 main formulations. Merck, done by company Merck. It is named Recombivax hepatitis B. 0.5 ml pediatric, 1 ml adult, 1 ml but contains concentrated formula, 40 microgram for patients at dialysis. GSK company, NG-Rex, 10 microgram, 0.5 ml for pediatric, 20 microgram for adult. So the only company, Merck, does the formula for those on dialysis. This is the hepatitis B vaccine in schedule. We said it. Preterm infants, birth dose and hepatitis B immunoglobulin if mother hepatitis B surface antigen positive. Preterm infants less than 2,000 grams have a decreased response to vaccine administered before 1 month of age. Delay first dose until chronologic age 1 month if mother hepatitis B surface antigen negative. Adult hepatitis B vaccine candidates: healthcare workers, persons receiving hemodialysis, injection drug users, persons diagnosed with an sexually transmitted disease, heterosexual with multiple partners, prostitutes, men who have sex with men, MSM, men who have sex with men. Other hepatitis B vaccine candidates: recipients of blood and blood products, staff of institutions for developmentally disabled, immigrants and refugees, long duration travel to areas of high endemicity, adoptees, orphans, unaccompanied minors, household members, and sex partners of hepatitis B virus carriers. Post-vaccination serologic testing, not routinely recommended following vaccine of infants, children, adolescents, or most adults. Recommended for hemodialysis patients, infants born to hepatitis B surface antigen mother positive, sex partners of hepatitis B surface antigen person, immunodeficient persons, health care workers, anti-hepatitis B surface antibody titer of 10 milli international unit per milli or higher equal protection. 10 milli international unit milli or higher equal protection. Post-vaccination serologic testing. Healthcare workers who have contact with patients or blood should be tested for hepatitis B markers immediately after the incidence at 3-6 months for antibody after vaccination. Management of non-response to hepatitis B vaccine. Complete a second series of 3 doses. Should be given on the usual schedule of 0, 1, and 6 months. Retest 2 months after completing the second series. Hepatitis B vaccine adverse reaction. Pain at injection site, mild systemic complaints, increased temperature more than 37.7 degrees centigrade, severe systemic reaction. All this may occur, but with little percent. Hepatitis B vaccine contraindications and precautions. Severe allergic reaction to a vaccine component or following a prior dose, moderate or severe acute illness. وفي النهاية أقول الحمد لله الذي بنعمته تتم الصالحات و thank you for your good listening.